that we're actually living in. We're talking to Dr. Clark Newhall. He's the Director of Health Justice, an organization dedicated to health insurance for everyone here in the U.S., focusing on the single-payer system. And let's talk about single-payer system. What does that mean for somebody who's heard the term, they don't get it? All this happens right in the tracks of the Supreme Court versus Obamacare, as it's colloquially called, and what Dr. Newhall thinks might benefit if we have a fate, our healthcare organizations. Let me give their website, by the way. For those of you watching, you can obviously see the graphic above Dr. Newhall, but it is health-justice.org, health-justice.org. And Dr. Newhall, single-payer system, what the hell is that? We heard Obama mention it one time, and then he never said it again. It must have been that terrible.
It must have been. Actually, very interesting that Obama just recently, in a press conference, talking about this same Supreme Court decision that's coming up, said, look, there's only two ways to make sure everybody has health care. One is the single-payer system that people call Medicare for all. The other is to make everybody buy health insurance. He said there's only two ways. He gets it. He understands. Now, he caved into the insurance companies and did the mandate and bailed out the insurance companies. Because after all, what is the mandate requiring people to buy insurance? It's basically a taxpayer bailout of insurance companies, health insurance companies. The only other
imagine Dr. Newhall, if you were an insurance company and I told you, by the way, starting next Tuesday, you're going to have 29 million new customers. You didn't even have to advertise for them. Mwah, mwah.
And not only that, but a lot of them are going to be taxpayer subsidized people too, right? So instead of having to go out there and sell your product, you don't have to do anything. You just sit back and you collect your 20% profit on top of whatever you're charging. And hey, you're fine. Single payer, on the other hand, is basically a method of collecting premiums to pay for everybody's health care, just like you do collect premiums from the insurance companies. But instead of having 1,700 health insurance companies, you have one. It's one big one, and it's called the U.S. government. And it collects every dime necessary to pay the bills. And by the way, when it does that, it saves us as a country $800 billion, that's billion with a B, big B, $800 billion a year over what we're paying now for health care.
We're going to talk about how that is because people won't believe that or won't get it. So we're going to have you break that down. Let me just reintroduce Harrison with you. You are listening and watching Go Harrison. This is part of our Google platform that we do on weeknights, a special adjunct here. We're talking to Dr. Clark Newhall, Director of Health Justice, an organization dedicated to getting health insurance to everyone in the U.S., focusing on the single-payer system. Their website is health-justice.org. We are streaming live, as always, at GoHarrison.com, GoHarrison.com, where you can see Dr. Newhall. You can see me in my beautiful new blue shirt. It's very exciting and fun. It is a medically necessary blue shirt. So I do that for you, Dr. Newhall. I follow orders here. Humor aside, because God damn it, we shouldn't have any fun here. Let's talk about, you said we say 800 billion with the B dollars. What?
Yeah, it's a pretty easy figure if you can do a little multiplication, division, and subtraction and addition. Let me show you how it works out. So we right now, as a nation, spend 2.4 trillion, that's trillion with a big T, big R, on health care in total. That's what we spend, 2.4 trillion. Now, the insurance companies are allowed to take up to a 20% hike on whatever they collect. So take 20% off of 2.4 trillion, and you've got, what? Well, 2.4, 4.8, you got 4.8 trillion. Take 30% off of 2.4 trillion, and you've got $800 billion. Where does that extra 10% come from? The extra 10% comes from the fact that because we have 1,700 health insurance companies, and every doctor, every hospital has to deal with many, many, many of them, we have a lot of paperwork involved, and that costs us at least 10% of what we spend on healthcare in paperwork, as opposed to Medicare. Medicare, which is the single-payer plan for everybody over 65, run by the U.S. government, premiums collected by the U.S. government, money paid by the U.S. government, doctors and hospitals, all private. Everybody gets to choose whoever they want to go to. Medicare. Medicare is only for people over 65. Why couldn't it be for people over 55 or over 45 or over 35 or over 0? Why couldn't it be for everyone? That's what single payer is. Medicare for all. Now, obviously, Medicare would have to have some changes. I mean, there are not very many people over 65 years old who are delivering babies. So, you'd have to put obstetrics into Medicare. But that's simply a matter of administrative ramifications. Not a big deal. Medicare for all is a single payer plan that can work for all of us. The government collects the premiums, pays the private doctors, pays the private hospitals, and by the way, clamps down on the pharmaceutical companies and says, well, we're happy to pay you and give you a profit, but not so much, guys, not so greedy. Which, by the way, is what the U.S. government already does in the purest form of socialized medicine in the world that we call the Veterans Administration. Veterans Administration is pure socialized medicine. The doctors are employed by the government, the hospitals are owned by the government, and the government says to the suppliers, like pharmaceutical companies, no, we're not going to pay your inflated prices, we'll pay less, and here's what you're going to get. So we have in this country single-payer health care called Medicare. We have in this country the purest form of socialized medicine anywhere in the world called the Veterans Administration. And then we have this mess called the health insurance industry, which basically is what we're all left with. We, all the rest of us under 65 years old, get screwed by being thrown into the health insurance industry. And we're paying an extra $800
Is that your airplane?
a year. Is that what?
Sounds like, is that your airplane? Are they calling your gate?
Yeah, I don't know. I'm getting some sort of Skype thing. Somebody's Skyping me, Harrison. I don't know what they're about.
Let me ask you a couple of interesting questions here. As we talk to Dr. Clark Newhall, he's the Director of Health Justice, an organization dedicating to getting all of us health insurance, as you've been hearing, single payer. It makes the most sense. You get the most bang for your buck. It's such a no-brainer. But there are forces against it. We've identified who they are. They're obvious. There is a huge health insurance, uninsurance, whatever you want to call it, industry.
Insurance.
Yeah, it's kind of like Wall Street with a syringe. They exist purely to take a piece of the action, but it has nothing to do with Dr. Newhall's sphygmomanometer. Am I right? Nothing to do with it. I know that word. And so let me throw a fantasy at you. Here's my fantasy. The quote Obamacare goes to the Supreme Court, and they rule that you can't really mandate to have it done through, you must go buy health insurance. So then we come up, Congress, sort of in a corner here now, like, Jesus, we said we'd give these people something. Maybe people could start to pay for it through their payroll taxes, much as they're paying military and FICA and all the rest of it. And then it just kind of gets handled. That's my fantasy. Is that likely to happen?
That's my fantasy, too. Let me tell you how it could have happened right off the bat. When Obama had a great big mandate from everybody right at the beginning of his term, he funked it. He could have done this with no supermajority necessary in the Senate. In other words, with no filibuster allowed in the Senate. How could he have done it? Well, as it turns out, passing a Medicare change so that everybody pays taxes as what they pay for their health insurance, health care, passing that kind of change is a tax measure. And tax measures are not subject to filibuster. So, at the very beginning of his term, when he had the opportunity to do that, Obama could have said, okay, we're going to make a tax measure. The tax measure is going to be we're extending Medicare to everybody under 65 all the way down to negative 9 months of age. And we're going to make it so that everybody pays into it through their payroll taxes. And that's the bill. Here it is, Congress. Pass it. And it would have passed. And then all he would have had to do after that was go to the administrative arm of the Health and Human Services people and say, okay, now we're going to write some new regulations saying that Medicare covers obstetrics, it covers neonatal care, it covers all these other things that need to be covered. And oh, by the way, we're going to be collecting the money on premiums from everybody's payroll starting tomorrow. And you know what? It could have been done. It could have been done, except for the price tag that Obama put on his administration early on. Except for the fact that we had too many people taking stakes in the business. Could have been done.
Yeah, and steaks that go through the heart, my favorite
Yeah,
kind. Speaking of steaks, Steaks, and you're a doctor who is also a vegetarian. There
well, a lawyer
is,
too.
and a lawyer, a doctor and a lawyer. I'll bet the women were hurling themselves at you. A doctor and a lawyer who's a vegetarian. You've put thought behind it. It's not poof magic. Tomorrow I'm going to be a vegetarian because it's fun. Tell us from a doctor's standpoint why being a vegetarian is a better choice. Clearly, it's a better choice. And you noticed the Mr. Haney? I said clearly? Yes. Green Acres, homage.
Well, I wish I could say I were really a vegetarian. I can't say that. I have to confess I do eat meat sometimes, and I like it. Yeah, but in terms of being a vegetarian, yeah, you need to eat vegetables. I mean, if you eat meat, you're just eating vegetables the wrong way. You're eating too much fat with your vegetable. That's what meat is, vegetable with fat added on, and you don't need it. You can do it just with vegetables.
I have a friend, 38 years old, hadn't seen the guy in 10 years, called me up. He was here in LA at Cedars-Sinai, which for people watching, if you don't live in Los Angeles, very, very famous hospital, very, very famous. And he was in there, he's getting treated for rectal cancer. And it turns out the guy eats 60, 70% of all his meals at McDonald's and Burger King. He eats those deep fried elephant scabs every day as his prime meal. And is it a coincidence that he has rectal cancer, which they believe they can successfully treat? Or, I mean, that's something that like an older guy would get, isn't it? Much older guy.
There's lots of different kinds of rectal cancer. I mean, the guy's doing himself no favor by eating McDonald's, particularly since McDonald's doesn't even serve wine.
Well, shit, there you have it. There you have it. Let's talk for a second, Dr. Clark Newhall, who is Director of Health Justice, an organization dedicated to getting health insurance to everybody, all 307 million of us, focusing on the single-payer system. Why is it that it feels like, and it may not be true, but it feels like you're one of the few lone voices as doctors saying, yeah, what a great idea. Like, why aren't there millions of doctors standing up? We're told officially, well, it's because there's no profit in it and they can't go play golf. Does anyone play golf anymore? Seriously?
Well, I don't.
I got 80 patients to see in the next 30 minutes.
Yeah, that's about right.
I don't know what's going on with them. I don't even have charts, but I got 80 patients. That's go team.
Yeah, well, according to the Physicians for a National Health Program, which is the umbrella single-payer organization of physicians, according to the polls that they've conducted and others have conducted, 60% of doctors favor a single-payer plan. Now, I would say that the 40% that don't are the guys who do very well off of putting in unnecessary knees or putting in unnecessary hips or whatever. But I've talked to a lot of doctors who do favor it. Now, I have to admit, I run in rarefied circles. I mean, I'm I'm kind of a black sheep among doctors, so I don't talk to the regular guys a lot. But there are a lot of doctors that favor single payer, and the more people know about it as doctors, the more, if they care to be doctors, they would agree. I think it's just a better way to provide medicine. You don't have to mess with 1,700 different health insurance companies. You've got one person that pays you. That's the government, and they pay on time. As a matter of fact, by the way, the government, according to the AMA, pays better and quicker than any of the insurance companies do. So I don't know what the beef is. Why would you want to be having to have 5 billing clerks to deal with all these insurance companies when you could have, a bill that you write out on a scrap of paper and send into the government? That would be ideal.
So Let me make a comparison, and we'll wrap this up here shortly. We're talking to Dr. Clark Newhall, Director of Health Justice, an organization dedicated to getting all of us health insurance using single-payer health system. Harrison with you. You are watching and listening to Go Harrison. We are streaming at GoHarrison.com, as we always do. We're also on the Google platform, and parts of this will be airing on regular broadcast terrestrial radio. And Dr. Newhall, in Germany and France, Great Britain, Canada, and other Nordic countries even, we like to imagine that they're socialist bastards, and every one of them should be flogged in the public square for being horrible, semi-communists. Are their people per capita healthier than ours with their icky poo-poo medicine system?
Yeah, they are. They live longer. And the French have the acknowledged best medical system in the world. They live longer and they smoke and drink more. So I don't know how you do that. They eat more too. So I don't know how you do that.
And they're thin. They eat chocolate and smoke and they're thin.
Now, I'll tell you something. In Taiwan, not known to be a socialist country, I think. In fact, I think that's where we get all our computers from. They're pretty capitalist. Taiwan, in the last decade, decided that they wanted to provide health care for all their people. They had a chaotic system, very much like ours. What did they do? They hired a smart guy from Harvard who's a health care economist. He went over there and he said, okay, here's your choices. Choice 1, choice 2, choice 3. Choice 3 was Medicare, exactly like Medicare in the U.S. Exactly, except that it extended to everybody. He said, here's your choices, 1, 2, 3. They chose Medicare. And they now have a Medicare for all system in Taiwan that costs them less than 2% as an administrative overhead. In fact, Medicare in this country costs less than 2%. It's 1.3% administrative overhead, whereas any insurance company is 20% at least. So, we're getting screwed, and we're paying big bucks to health insurance company CEOs for the privilege of getting screwed.
Now, there are, as I understand, a variety of different kind of collectives, if you will, of physicians that do pro bono work. They set up tents, and people can come in and get healed. I know it feels like a tabernacle in the 1920s. Shit, we're down to that, right? And these things pop up here and there throughout the country. Are you a participant in any of this, or do you know anything about it?
I do know something about it. The people that do that go around the country setting up several day long health events for poor people. And one of them was influential in making the guy who was the head publicist for the biggest health insurer quit his job and become an advocate for single payer. He said it was an eye-opener to him when he went into one of these day-long events or several day-long events in a small rural area. I think it was in West Virginia, and they had set up the clinics in stables, fairgrounds. And he thought, my God, we're treating our people like animals. We're treating them worse than animals. We're treating people in stables because they don't have money. And he quit his job as the guy who was the head publicist for a big insurance company. In fact, he was one of the guys that was instrumental in trying to take all the fire out of Michael Moore's movie Sicko. That the insurance companies tried to scotch and were unable to do so. But this guy was one of the guys that tried to do that. And
let me recommend a movie to you. It's not one that I don't know you well, Dr. Newhall. It's not one that I imagine you're going to hunker down with popcorn and watch on your own. It's grim as hell. It's Saw number 6.
Saw number 6.
You're familiar with the Saw movies. You're familiar with them.
Yeah.
It's a slash and chain. It's horrible stuff. But it's always poetic justice. It's always the bad guys get it in the end. And in Saw number 6, the bad guy is the insurance executives.
Right on.
And it's brutal. It's gruesome. But boy, it's that clever. The ball drops gravity. It goes up and over the circle and down and cuts off his arm. And they writhe and wiggle. And there's a certain kind of poetic justice in that. And this is a publicly, this is a major commercial movie, which is how these discussions, unfortunately, have to get out in either burlesque, uh, slasher, mainstream discussions like you and I are having. So thank God for a few perverse artists in Hollywood. And thank God for you, a real live bona fide doctor saying, but helping people is good. Right?
Thanks, Harrison. The helping
We're
people.
really glad to have you aboard. And with your permission, we'd love to check in with you again and again down the road and see how you're doing and how we can help.
And when the Supreme Court issues their decision, and by the way, I predict that they will uphold the PPCACA bill and the mandate, or find some way to make it possible for the insurance industry to continue to suck on the government tip.
Yeah. Well, it's really an udder, isn't it?
Udder, yes.
It's an udder with mastitis.
That's right. Oh, that's right. I'm sorry. The 7 deadly words. I can't say that. Sorry.
Mastitis. Thank you so much, Dr. Newhall, Director of Health Justice, an organization dedicated to getting all of us health insurance, every one of us, using the single-payer system, much as similar to or identical to the extraordinarily successful versions we see overseas where people live longer while eating chocolate, lots of butter, smoking, and drinking. It's a miracle. Not really. It's just basic science, regardless of what Jesus might have said or didn't say, depending on who's running for president. Harrison with you. Let me give out the website. It is health-justice.org, health-justice.org. Harrison with you, Dr. Newhall. Thank you so much. Thank you, Billy Foster, who is running our operations in Phoenix, Arizona, snuggling under the fleshy bosom of Jan Brewer there while reaching around to Sheriff Joe Arpaio and pleasuring him as well. You are a sole advocate and fighter out there, Billy. God bless you. I'm in West Hollywood, surrounded by homosexuals, so I'm safe and sound. And thank you so much, everybody, and have a great night.
Thank you, Harrison.
Did I frighten you there at the end?
That was good. I loved it.
All right, you guys. See you later.
See ya. Bye-bye.
Bye.
Thank you so much. Bye.